Hi, it's nice to see you. Do you mind telling us who you are?
Hi, Sofia. I am Mauro Cabral Grinspan, and I am the executive director of GATE, and I'm based in Buenos Aires.
I would love to talk about a little bit is the way in which COVID is being used by different governments to put into place repressive legislation that is not necessarily even connected to COVID. So can you talk a little bit?
What we are seeing in different parts, and in some cases was the way which like a proposition, like in the case of the US, for example, to propose some kind of policy to regulate the access of trans women or trans people in general to shelters, producing some bodily identification to be able to identify trans women by their appearance. Or in the case of the UK, putting into discussion if trans people should have access to hormones or not, or to legal gender recognition or not. In the case of Hungary, it was a decision to cancel the process on legal reform to allow trans people to get access to legal gender recognition. But what we have in different countries at the same time, at the bottom line, is a discussion on if trans people have the right to exist or not. And I'm sorry for putting this dramatic, but when it comes to be about accessing basic healthcare or even basic protections like access to a shelter, what we are seeing is it's happening to us, but also to other minorities, and it's happening to migrants everywhere, that we are disposable people.
And do you see COVID being used as an excuse to do things that repressive governments are wanting to do anyway? Do you think that it's disconnected from COVID? How is it that you see this interacting with COVID?
I think that they are using us as a distraction, that trans people or migrants or any other thing that could concentrate people's attention is distracting public opinion from the lousy job that the governments are doing, in different countries, that we are used that way, and people get engaged, So, and we have been like initiatives, all kind of crazy conspiracy theories, blaming minorities. We believe that we are the excuse. Of course, we're talking about anti-democratic regimes, even, happening in democracies, within democracies. All of that is used as an excuse to distract the public opinion on how the COVID pandemic is being managed.
I totally hear you. I mean, do you see any place where you can point to any good policies that are happening?
But that's a difficult questions, because we are not seeing a lot of progressive governments or governments doing great because of different regions. What we're seeing is a very intense community organizing. So I will say that this is an extremely painful moment for activists and groups everywhere. At the same time, it's a moment of increased community organizing, and also what we are seeing is a lot of solidarity among different movements, among groups in different continents, to address these issues together. So I would say that my hope is there.
Okay, well, that's a positive thing. If there is mobilization, if there is organization that's happening amongst groups, that maybe that's something that maybe can outlive or outlast COVID in some ways, if there's ways to be able to work with that.
The other thing I will say, that what we are seeing is also in some countries, let's say Brazil or the US or Spain, or like in different places, what we are seeing are progressive politicians taking a stand and saying, well, if we get the chance of being in the government in the future, we're going to take care of this, or we're going to address that. So in that sense, it's also an opportunity for building alliances looking into the future.
That seems important, and also in terms of then ensuring accountability for those statements later as well.
Yeah, of course.
Right?
Yeah, first we need to get there. I am more like I like to have my eyes on the horizon, but also going step by step.
In terms of the trans communities that exist around the world, are people able to interact with one another? Is there a sense of offering support in relationship to COVID? Are there networks that are happening in terms of being able to offer not just emotional support, but support in terms of seeing, this is what my government is doing, this is how we're addressing it, this is how my government, this is how we're addressing it? Is there that kind of solidarity happening as well?
It's that kind of political learning, it's happening, but right now I will say that most of the support is needed at the very basic level of people getting money to buy food and to have access to hormones, for example. And what we are seeing is that there's also a lot of mutual learning and a lot of South-South learning in how to put together campaigns or fundraising just to support extremely vulnerable communities. So, but including, you know, trans people in prison or homeless trans people, so, and trans sex workers that have not been able to work. So all of that, we're seeing a very intense process of learning, collective learning, and how to organize that. There is a strong international movement that have a long tradition of mutual learning. So I hope that the problem probably, you know, is that our governments are not doing great. So there is not much to learn from that. But we know now that, for example, it's very clear that we also need our people everywhere, including ministries of health. It can be that the next pandemic or the next crisis that we need to make the case, for example, about that our needs are essential needs in terms of access to healthcare, that knowledge needs to be there. So what we are also seeing is this production of critical knowledge that need to be in the right places for that to be transformed into effective community responses.
Super helpful. Thank you. I really appreciate this.
Thank you very much for the conversation.